So have you ever heard of estrogen dominance? Have you ever heard of low estrogens? Have you ever heard of fluctuating estrogens? Now, these are all potential challenges for any woman dealing with menopause symptoms. Now, typically you only hear about low estrogen. And usually the story goes, well, you're postmenopausal, so your body no longer has the ability to produce estrogen. So therefore, if you're postmenopausal, you have low estrogen. Well, that's not true. Yeah, because I've seen plenty of women, and I've helped almost 7,000 women over the last 19 plus years overcome their menopause symptoms, looking at very comprehensive 24-hour urine collection test kits to understand really on a deep level what's going on in your hormonal system, and always looking at all three estrogens, your E1, your E2, and your E3. Now, yes, sometimes a woman in postmenopause will be low estrogen. Sometimes you see fluctuating estrogens, and even, believe it or not, sometimes you even see elevated estrogens. Now, the elevated estrogens could be, really there's two main factors of why your estrogens would be elevated. Now, number one is really self-induced, because the number one reason I see that women have too high of estrogen is you're using estrogen creams or estrogen patches. Now, I recognize that you probably have this recommendation from your doctor because you did a blood test and your estrogen is low, so they suggested these creams or patches. Now, logically, it makes all the sense in the world. But to understand it a little bit deeper is when you're using a cream or a patch, you're depending on the assumption that you have optimal vascular absorption. So what that means is you put the cream on your skin or the patch on your skin, it absorbs into your skin, and once it gets into your skin, it gets into the blood where your body can actually use the hormones. Now, that makes sense if it's working that way, except the problem is that some women have very poor vascular absorption. So what can happen there is now the estrogen can get into the skin, but not into the blood. And the problem with that is then it builds up in your tissue. Now, that's a problem, because now when you're doing the proper testing, which would be with a 24-hour urine collection, you're not only going to see what hormones are in your blood, you're also going to see the hormones that are built up in your tissue. And if you have hormones, specifically estrogen, built up in your tissue, that's a risk factor for breast cancer, as well as a risk factor for many other chronic disease states. So you want to make sure that you actually have the estrogen going to the right place, which is into your blood. And the only really way to tell that, it's not with blood, it's by testing with either a 24-hour urine collection that I use, or the use of a 24-hour test with saliva. I prefer the urine because I'm looking at so much of what's going on in your hormonal system. I'm looking at literally 32 different hormones, plus how your kidneys, your liver, your inflammatory conditions and chronic disease states are all affecting what's going on with your hormonal system. Yeah, but anyway, you have to understand, where is the estrogen going? Is it getting into my blood where I'm benefiting from it, or is it being stuck in my tissue where it's to a potential detriment to me? Now, the other risk factor for why your estrogens could be too high is if your body is inappropriately converting testosterone into estrogen. Now, you see this happens when you overproduce an enzyme called aromatase. So very simply, aromatase is an enzyme that will take testosterone and convert it into estrogen. Now, I see this, unfortunately, far more than I would like to, but I see women's panels come back with a hormonal system where their estrogen is high and their testosterone is in the tank. So not only is the high estrogen now that risk factor, as I said, for breast cancer and many other chronic disease states, the low testosterone would leave you then unmotivated, gaining weight around the midsection, a total lack of interest in sex and intimacy, and makes it very difficult for you to build and maintain muscle mass. All of which are issues in and by themselves. So really the key is to test properly, which, as I said, I'm always using a 24-hour urine collection so I can really see what's going on in your, not only in your blood, but also what's going on in the tissue in your body. And also where you can actually see if you are overproducing that aromatase. Now, to take it one step further, the aromatase itself isn't the issue. Then the issue is you have to think of, well, why am I overproducing this aromatase, which is usually tied into problems with blood sugar, and more specifically, when the blood sugar is high, then the insulin goes up. So it's the elevated insulin that is a big issue that's driving the overproduction of the aromatase. But all of these things can be looked at and understood through testing, and then you can make the proper choices in your daily lifestyle and supplemental choices to really turn this around, regardless of what's causing these challenges. And I just really want you to know that in the end, yes, low estrogen could be an issue. Fluctuating estrogens can be an issue, and elevated estrogen can also be an issue. But that's only one piece of the puzzle. You really want to look at all these hormones comprehensively together, have the deepest, most comprehensive understanding of what's going on in your hormonal system, get to the underlying triggers of this, and really find your hormonal bliss. Find that balance and the symptom relief from menopause that potentially you've been looking for years. So more to come. Stay tuned, and please hit that like button and click on the little red bell in the upper top so you get these messages from me to help you either prevent or overcome menopause symptoms.